Hey folks, it's Dr. Sam, and I received a question today from Jonathan. He's been diagnosed with a corneal condition called Anterior Basement Membrane Dystrophy. This is a type of corneal dystrophy. He's also been diagnosed with dry eye. He seems to be doing pretty well with managing that, but he wants to know if I have any advice for the cornea. So we have to know a couple of things. First of all, that when you have any kind of corneal dystrophy, the enemy of the cornea is dehydration. And the eyelids are the place where we produce the tears that cover the cornea. So treating the inflammation in the eyelids actually helps with tear production, and it also helps support a healthy cornea. So one of the processes I recommend is in the evening, I would get some organic castor oil and I would just take a little bit and I'd start massaging it on the outside part of the eyelids. Castor oil has been found to be very soothing for the eyelids. My patients love it. It's very moisturizing. So that's what I would do in the evening. During the day, I would do the 5% MSM eye drops, and I would also couple that with either the TheraTears or Oasis Tears, and I'd probably be doing an alternation maybe 4 to 6 to 8 times a day to keep the corneas hydrated. Because when they start becoming dehydrated, this wreaks havoc on the collagen. Now, the cornea is made up of mostly collagen, and so we have to think about how can we support collagen health. So the MSM during the day, the castor oil in the evening, and then adding foods that boost our collagen levels. So this could be things like hyaluronic acid, bone broth, MSM. So that's one thing to consider. And then another thing that the cornea really needs is B vitamins. So important for corneal health. I would also recommend all the other antioxidants that I talk about, things like bilberry and resveratrol, ginkgo, and of course, your omega-3 fatty acids, especially the DHA in the omega-3s. And then protecting your eyes from the damaging blue light, so making sure you're using some blue blocking filters, and even sun lenses when you go outside to protect your cornea. Eye exercises are another thing that I would suggest. The way you use your eyes can affect the structure of the eyes. So getting a holistic vision exam and figuring out, are my two eyes working together? Am I wearing the right lens for my computer use? These are some of the things that you need to evaluate beyond an eye health exam or just getting acuity checked. So, Jonathan, that's the short answer. I wish you the very best. Thanks for the question.